Do you know how to spot dangerous brain damage in your dog? Today, we're exploring this critical topic that all dog owners should be well versed in. The joy our canine companions bring us is immeasurable, making their well-being a top priority. Recognizing the signs of potential brain damage is key to early intervention and ensuring the best possible outcome for your cherished pet. Stay with us as we uncover these signs that could save your furry friend's life. First off, we must understand the signs related to altered consciousness. This is a key indicator of potential brain damage in dogs. The first sign is a loss of consciousness. This occurs when your dog suddenly faints or collapses, unable to respond to their surroundings. Next is a state of stupor or the inability to wake up. This can be particularly alarming as your dog may appear asleep but will not respond to stimuli like touch or sound. Lastly, we have seizures or convulsions. This is when your dog's body shakes rhythmically and uncontrollably. Seizures can be a sign of various health issues, including brain damage. It's important to remember that these symptoms are not to be taken lightly. If your dog shows any of these signs, it's essential to act swiftly and seek veterinary care. These are serious symptoms that require immediate veterinary attention. Moving on to the next signs, let's talk about abnormal eye movements and coordination issues. One of the first and most noticeable signs of potential brain damage in dogs is abnormal eye movement. This can manifest as rapid, uncontrolled flickering or shaking of the eyes known as nystagmus. Another possible sign is unequal pupil size or anisocoria. This condition may be noticeable if one pupil is significantly larger than the other. Now let's discuss coordination issues. You might notice your dog losing balance, displaying difficulty walking or standing, or even showing signs of a head tilt. These could be telltale signs of brain damage as they suggest issues with the brain's motor control. Our furry friends are usually agile and coordinated, so any sudden changes in their movements could be a cause for concern. Any sudden changes in your dog's eye movements or coordination could be a red flag for brain damage. Now let's delve into abnormal behavior and motor function impairments. In the realm of abnormal behavior, sudden aggression or uncharacteristic behavior changes can be indicators of potential brain damage. Your gentle, friendly Fido, suddenly growling or snapping can be alarming. This abrupt change in demeanor could be a sign of neurological distress. Similarly, confusion or disorientation can also signify possible brain damage. If your dog seems lost in familiar surroundings or has trouble recognizing family members, it might be more than just a bad day. Another critical aspect is the lack of responsiveness to familiar commands. If your dog suddenly ignores or doesn't seem to understand commands that they've known for years, it's a cause for concern. It's not a matter of disobedience but potentially a neurological issue at play. Moving on to motor function, impairments, weakness or paralysis in one or more limbs can be a strong indicator of brain damage. If your dog struggles to stand, walk, or even move a limb, it's time to consult a vet. It's not just about physical strength, but also about the brain's ability to control these movements. Inability to control bodily movements is another significant sign. This could manifest as unusual gait, tremors, or even seizures. You might notice your dog stumbling, twitching, or having difficulty with tasks that were once easy, like climbing stairs or fetching their favorite toy. It's important to remember that these signs can also be symptoms of other medical conditions. However, if you observe a combination of these symptoms, or if they persist or worsen over time, it's crucial to seek veterinary advice. Early detection and treatment can make a significant difference in your dog's prognosis and quality of life. In conclusion, our dogs are experts at hiding pain and discomfort. They rely on us to be their advocates and recognize when something is wrong. Any drastic changes in behavior or motor function should not be overlooked. Next up, we have abnormal reflexes and difficulty eating or swallowing. Let's start with abnormal reflexes. Dogs, like humans, have a set of normal reflex responses. These are involuntary reactions to stimuli that help them navigate their environment. For instance, if you toss a ball towards your dog, its reflex is to catch or dodge it. However, when a dog has potential brain damage, these reflex responses may be off. Your dog may lack normal reflex responses, or even display overactive or exaggerated reflexes. Imagine tossing a ball towards your dog and it doesn't react at all. Or perhaps it overreacts, flinching or cowering, even if the ball is nowhere near it. These unusual responses could be a sign of brain damage. Now let's move on to difficulty eating or swallowing. This is another sign that may indicate potential brain damage. It's important to note that a dog might have trouble eating for a variety of reasons, such as dental issues or a sore throat. However, if your dog suddenly starts having problems chewing its food, frequently chokes, or seems to gag when trying to swallow, it could be due to brain damage. Consider this scenario. You're feeding your dog its regular kibble, but it's struggling to chew or swallow. It's choking more frequently than usual, or seems to be gagging when trying to swallow. This isn't just discomforting for your dog, but it's also a potential sign of a serious neurological issue. Remember, these signs are not definitive proof of brain damage. They are potential indicators that something might be wrong. If your dog displays any of these symptoms, it's crucial not to panic but to seek immediate veterinary attention. Early detection and intervention can make a significant difference in your dog's health and quality of life. These signs can indicate a serious issue and should be addressed immediately. Let's now discuss loss of sensation and changes in vital signs. Dogs are known for their heightened senses, particularly their acute sense of touch. However, brain damage can disrupt these sensations, leading to a loss of sensation. This could manifest as an inability to feel pain or respond to stimuli. A dog with brain damage might not react to things that would ordinarily cause discomfort, like a sharp object or extreme temperatures. In some cases, they might show an unresponsiveness to touch or environmental stimuli. For instance, they might not react to your gentle touch or even a loud noise. Now let's move on to changes in vital signs. These are crucial indicators of your dog's overall health and can provide insight into the state of their brain function. An irregular breathing pattern, for example, could suggest that the brain is not effectively regulating the dog's respiratory system. This could present as shallow, rapid breaths or, conversely, slow, heavy breathing. Changes in heart rate or rhythm are also significant. A healthy dog's heart rate should be steady and regular. However, brain damage can disrupt this rhythm, leading to a heart rate that's either too fast or too slow. Finally, let's talk about changes in body temperature. The brain plays a key role in regulating a dog's body temperature. If brain function is compromised, it can lead to fluctuations in body temperature, causing your dog to feel unusually hot or cold to the touch. This could indicate that the brain isn't effectively communicating with the body's temperature regulation systems. In summary, loss of sensation and changes in vital signs are serious indicators that your dog might be suffering from brain damage. If you notice any of these signs, it's essential to seek immediate veterinary attention. Early intervention can make a significant difference in your dog's prognosis and quality of life. These are serious signs that may indicate your dog is suffering from brain damage. Lastly, we'll talk about visible head trauma. This is a more obvious sign of potential brain damage in dogs, but still crucial to be aware of. Visible head trauma can take the form of open wounds or fractures on your dog's head. If you notice any unusual marks or cuts on your pet's head, it's important to take action promptly. Swelling or bruising on the head or face are also indicative of head trauma. These might not be as apparent as open wounds, but they're equally significant. Be sure to regularly check your dog for any unusual bumps or discoloration that could suggest bruising. Remember, even minor head injuries can lead to serious complications, so don't take these signs lightly. It's always better to err on the side of caution. If you observe any of these signs, seek immediate veterinary attention. Your prompt action can make all the difference. Visible head trauma is a clear sign of potential brain damage and requires immediate veterinary care. In conclusion, being aware of these signs is crucial for the well-being of your dog. From altered consciousness to visible head trauma, these indicators can be subtle or glaringly obvious. It's all about keeping a close eye on your furry friend's behavior and physical condition. Spotting these signs early on can lead to swift intervention, potentially mitigating severe health consequences. So don't dismiss any unusual behavior. Remember, early detection can be a game changer in the health of your beloved pet.